All right. There we go. Excellent. So welcome. Molly and I are going to be presenting today. My name is Ashley Secord. I'm an LMFT in the state of Minnesota. I also have a group practice called Thrive Therapy. I also named my billing and credentialing company Thrive Services, which at tax time is super confusing. I don't recommend naming two companies something so similar. Molly has been working with me at Thrive. She is since the very beginning, since 2019. And she is our project manager. Do you want to share a little bit about yourself, Molly?
Yeah, absolutely. So I have been doing billing and credentialing and the like for over a decade now, which is still shocking to me. And I recently graduated with my MBA. And so Ashley and I have been doing some really awesome stuff, utilizing that skill set, being able to branch out and do some of these trainings. So one of my favorite things to do is to actually help providers learn more about the background of what they're doing. So how they're getting paid, why they're not getting paid, and how to fix it. So that's kind of what I love about this. So I'm really excited to be a part of the supervisory protocol because this is actually some new information for me too. So
yeah. Great. In addition to this event, we also have two upcoming events in the next, at the end of this month and next month as well. Next month, or at the end of this month on September 25th, I'm going to be chatting with Nicole Keeber-Lewis about her book, How to Love Your Business. She talks about how your relationship with your business can sometimes replicate relationships from your past, sometimes traumatic relationships from your past. And her book goes through ways to have the relationship that you desire with your business. I love the concept. I love Nicole. She is a really an amazing business coach, and she's no longer. I don't think she kept her credentials, but she was a licensed therapist in her previous life. She's just a gem of a human being. So I definitely recommend that. And everybody can benefit from the independent contractor agreements for therapists. A conversation with David Holt. If you're in Minnesota and don't know who David Holt is, I would say he's sort of the go-to for therapists who want an attorney who's familiar with the guidelines and Minnesota statutes for therapists in Minnesota specifically. There's also going to be some general information, but that is a sort of a do not miss. That one I think would be very, very good for anyone who is looking to hire or has hired contractors to their practice. Great. Anyway, we're going to get started. It looks like a lot of people have showed up. So let's just jump right in. Okay, so I'd like to do a little what to expect before going in. The first thing that we're going to do that will take sort of the bulk of the time, bulk of our time today, is going to be reviewing the supervisory protocol audit. I'm going to review each of the audit tools. There's 3 of them. And then I'm going to actually show you examples. Like I took screenshots and put them into this PowerPoint slide so you can see exactly what it looks like, what type of things that they're asking you to complete, that sort of thing. Then we're going to review steps to prepare your private practice with the required documents that they're requesting. The policies and procedures, there's so many. There's treatment records, personnel files. There's a lot of information that they want you to provide them. So we're just going to go through some preparation for that. And then we're going to talk about strategies for reducing your anxiety leading up to the visit, leading up to the site visit. There is a lot. The supervisory protocol audit is a lot of information, and it's big. It's just very large. So if it creates a little bit of anxiety just going through this free talk about it, it's warranted. But I think you'll have some good tips to go off of just by attending this. And then lastly, we'll show you some resources for making your audit go smoothly. Before we get started with some of those slides, I just wanted to do a little bit of a baseline information and get to know about you and your practice. Where is everyone from? And you can just respond in the chat. Welcome from Texas. Hi, Danielle. Great.
I guess I should say I'm also from North Carolina, so.
True. 2 from Texas.
Awesome.
Lovely. Excellent. Great. If you currently have a group practice, how many contractors or employees does your practice have? And if you don't have any, that's fine too. Working on it. 7, great. 3, awesome. 1 for now. Great. Nice. Congratulations. Do you have any pre-licensed staff in your group? Or are you here because you are interested in having pre-licensed? Great.
Awesome.
Excellent. Yes.
Cool.
Excellent. Awesome. You guys are in a great position.
Absolutely.
Are any of you familiar with Optum's supervisory protocol or know a colleague who has gone through it? Great.
Know a little bit.
Danielle, you know me, so you kind of do. Great.
Cool.
Excellent. Awesome. Cool. So I'm going to give you, this is sort of the overview of Optum's supervisory contract. So the supervisory contract is essentially Optum's group contract. They don't allow you to sign up for a group contract until you have 5 providers. The sort of blurry line is you can still sign up for Optum with your group MPI and your group tax ID and have other providers listed under that group tax ID and group MPI, but they just don't call it a group contract, which is just like difficult to understand. So this supervisory contract is what I consider their group contract that allows non-credentialed clinicians to render services while under the supervision of an independently licensed clinician. And I understand it says that allows non-credentialed clinicians. Please understand that that the pre-licensed staff are non-credentialed. This does not necessarily apply to your friends that are licensed and you're supervising them. This is non-credentialed is essentially your pre-licensed staff that aren't eligible for credentialing. The terms of that contract, this is a very tightened review of that contract. The clinicians rendering psychotherapy must have a minimum of a master's degree, so no interns can provide services under this contract. All services that are rendered must be within the scope of the clinician's training, so they shouldn't be providing service to any client demographic that they are unfamiliar with or untrained on. Supervision must occur regularly on a one-on-one basis and be documented. And we'll cover some of that information later on. And then just a heads up that the contract authorizes Optum to periodically conduct chart audits to ensure compliance with Optum's policies and procedures. Any questions so far? I know we just got started. Was everybody familiar that you had to have 5 licensed providers for the contract to even request the contract? Okay, great. Excellent. So this is just a really overview of the timeline of what it would look like. So requesting the supervisory protocol contract, you're going to contact Optum through your provider line and formally request this contract once you have 5 licensed providers on staff. That is the first question they're going to ask you, is if you have 5 licensed providers, because ultimately it's a full stop at that point. You cannot bill, or you're not supposed to bill for pre-licensed staff through any Optum plan unless you have written language from the specific payer saying that you are authorized to do that. But ultimately, like I would direct all traffic towards your licensed providers until you have the supervisory protocol in place. From there, Optum will initiate the process. They will get your request, and that request will go to an Optum clinical quality analyst who will reach out to you initially via email to set up a call to go over the audit tools and schedule your site visit. That phone call will be about 30 minutes. All of the quality analysts are mental health professionals in your state, so they're familiar with the licensure process. It's not some Optum employee who doesn't know what we're supposed to be providing. So I actually think that that's really great that Optum hires mental health professionals to do these audits, because you're essentially going to be meeting with a colleague, and that's a little bit of a warmer experience in my head before I experienced than picturing just somebody coming in and checking off boxes off of my practice. So from there you will then tangibly in your email have all 3 audit tools to review. During that call, they're going to emphasize which areas are most important, and I would just take notes. Ask them if you can record the call, because they're going to go through so much information during that call that isn't really going to make a lot of sense until you have had a chance to read through all of the audit tools. And you probably won't have them before that phone call, or if you do, it'll be briefly before that phone call. So I just encourage you to just take a lot of notes, ask them to repeat themselves, and then just jot it all down. And then when you go through the audit tool, it's probably going to make more sense. When I went through my audit call, the only thing I remember her saying was how important the coordination of care part was, and that they really emphasized the importance of that. Like, honestly, that's all I remember from that because she was like, this is very important. She also tried to reduce my anxiety, which I was like I mentioned earlier, I was totally trying to play it cool. But it really, I did not play it cool. So after that, once you have the audit tools in your possession, read through them more than one time. You're going to notice probably a heavy amount of documentation that they are requesting that you do not have, but you probably have some of it. So focus on that first. Figure out and determine which documents and policies you do have, and then start to create a list of the ones that you don't, or use the audit tool itself and highlight in a different color, like which items you do have, and then a different color for the items that you don't have. And then going off of that, that was like, I probably utilized that strategy multiple times, like erasing all of the highlights and then going back and highlighting again. It was like the audit tools are your guideline. And then you're going to request access to a secure portal. So preparing for your site audit, during the phone call, they're going to ask if you want access to a portal that allows you to upload your documents as you go. And yes, the answer is yes. Even if you don't think you want that, you want access to the portal and you want to upload as many documents as you can in advance. It will, that is going to help your audit be shorter on the long run, in the end. So if you don't upload your documents, your audit is anticipated to be about 3 hours. But if you upload your documents in advance, they tell you that it will be less. I uploaded every single document that I possibly could before I had my site audit, and my audit was an hour. So I cannot recommend requesting access to the portal in advance. And then the last part of it is the site audit. Again, it's a conversational review of your documents, processes, and site with your clinical quality analyst. I ended up meeting with Miles. He was a lovely human being. He put me at ease like right away. I will tell you, my experience of that physical audit was amazing and great and very interactive and collaborative. And very much encouraging. So I didn't know that that's what the experience was going to be, which is part of why I'm doing this is to kind of get the word out that it's not as scary as it might feel. But the actual interaction with the quality analyst was very positive. So now we're going to go through the audit tools. There are 3 audit tools: the agency site tool, treatment record tool, and the supervisory protocol tool. The agency site tool and the treatment record tool, you have to pass with 85%. I don't know if accuracy is the right word. You just have to pass by 85% or more. The supervisory protocol tool is only 10 checklist items, and it's a pass or fail. The agency site tool and the treatment record tool, they're about like between 80 and 100 checklist item. They are much more cumbersome. And we will go through each of those. So the agency site tool is going to be covering your environment of care, policies and procedures. Like this is like your site human resources item. The treatment record tool is what they're going to use when they go through those 3 case files that you are requested to provide. And so this is their way of ensuring the standard of care is being provided and documented. The supervisory protocol tool is the proof of supervision by a credentialed supervisor, as well as supervision policies and procedures. And we'll start with the agency site tool. So the agency site tool has 9 sections: environment of care, rights and responsibilities, safety and security, addressing infectious diseases, treatment records, complaints, treatment access, patient safety, and service delivery. Now we'll just show you a little sample of what the audit looks like. So this is a screenshot. I'm not showing you any sort of like insider information. You can access the site audit tools on providerexpress.com. You could probably just search Optum agency site audit tool, and it would probably pull up a PDF. I know for sure you can with the supervisory protocol audit tool. But I just wanted you to be able to see what they look like and what they're asking for. So it starts off really like, hey, yeah, I've got all that, right? Facility location is easily identifiable from the street. The furnishings and decor are appropriately professional. Hey, this is going really great. The waiting room and patient care areas are adequate size, easy, no culturally offensive, insensitive information is posted. Yep. Fire safety plan. I don't have that. So some of them, they want to make sure that your location is safe for clients, right? They want to make sure that they have everything in place in order for, they want to make sure you have a disaster plan. If there is inclement weather, that there's something in place that your supervisees know what to do in the event of those issues coming up. So here's some more. I have 2 more samples to show you. Safety and security, policy addressing safety and security, policy and/or procedure dealing with life-threatening emergencies, comprehensive disaster plan. If something happened to the office and building, what is your plan to continue providing services? Your plan can be offering telehealth services. Policy and plan addressing management of spills of bodily fluids. And if you have this policy and procedure at your practice, I am very impressed. I had to create one. Next one, here is an example of lots of policies and procedures regarding the assessment of clients. So this is very supervisee directed, right? That they have a place to go regarding how to document an assessment. What are they documenting in the assessment? And that there's a policy for each of those sections for that supervisee to reference. So this talks a little bit about training. This talks a little bit about like just ultimately that nitty-gritty items on that list, where some of it seems really intuitive that it may not be for a supervisee. Before we move on to the treatment record tool, does anybody have any questions about the site audit? It's about 4 or 5 pages of that, of what I showed you. So this is a good question. Molly and I chatted about, do you have to have a physical site? So I'm going to say probably, considering, but I'm also going to say I don't know 100%. I have a physical site, so I had to run into that, and I don't know of the people that I know who have the supervisory protocol. They also have a site. So, and I'm assuming since a large part of the audit has to do with a physical location, I'm going to assume yes. But I'm not 100% sure. You can always request if you've already reached out to Optum or haven't reached out to Optum. I think that's a super great question to ask. But I would assume that a physical site would be required, but we're in a post-COVID world, so anything is possible. Can you have multiple practices at one site? I'm not 100% sure what you mean, but yes. I think I know what you mean. Like, can multiple practices be located at one site? Is that what you mean? Yes. So the answer is yes. So my office has multiple practices in it. And 2 of those offices were being, well, 4 of those offices were being utilized by my practice. And then there's probably 4 others that were being rented by other practices. So most certainly. That was a great question. Any others? All right. We'll move on to the treatment record tool. So the treatment record tool is going to be used to review 3 treatment records that you provide. 2 active and 1 inactive is what they'll request. And in that, they're going to review these 7 sections in the audit tool. General documentation standards, initial assessment, treatment planning, progress notes. They will have a section in there for medication management. If your practice does not include medication management, they will cross it off and it will not apply to you. Coordination of care and discharge and transfer. Now, you probably noticed that I have caps locked coordination of care as if I am yelling. That is because I am. Again, emphasizing that they really do put an emphasis on coordination of care, documentation, and I'll show you in just a second what the audit looks like for that coordination of care, and you can see that what they're specifically looking for. So there will be no surprises to, like, everything in the audit is exactly what your visit will look like and cover. So there's 0 surprises. Here's an example of the treatment record audit. This is the first page of it, just covering the general documentation standards. This is all very basic stuff that is very easy to check off. The record is clearly legible. Each client has a separate record, evidence of consent for treatment or informed consent, documentation of the risks of noncompliance with treatment recommendations and discussed with the client. So a lot of documentation about, like, some of the sort of administrative parts of treatment. More treatment planning. They have the treatment plan is consistent with the diagnosis. The treatment record includes a safety plan when active risk issues are identified. So they have like a whole section on treatment planning as well. This is the coordination of care section. So does the patient have a medical physician? So is the PCP listed on their intake documentation? Is there any evidence that we have reached out to that PCP? Even if we've reached out, but there's no response, is that documented? So that is the information that they're looking for. They're looking for a release that the client has confirmed that you can reach out to their PCP, and then any sort of documents that you collected from them, that sort of stuff. It's highlighted pink because it's important. I didn't highlight it, they highlighted it. Any questions about the treatment record tool? Any questions about not the treatment record tool? All right. Seems like we're doing good. The last tool is the supervisory protocol tool. It's the pass or fail one. It's 10 items. It reviews, these aren't the different sections that are listed. There's no sections listed on this tool, but it does cover, it reviews like the supervisor's credentials, the supervisee's credentials, policies and procedures around supervision, documentation of recurring supervision, and informed consent to the client that that your pre-licensed provider is not credentialed. Oh, somebody's coming back in. 1 second. All right. Here is an example of the supervisory protocol exam audit. So this is just the first 7. They're asking if the clinical supervisor is a credentialed clinician, that there's a written policy addressing the supervisory protocol utilized at the clinic. So this is essentially your standards for your supervisor, your standards for your supervisee. Patient's diagnostic assessment, treatment plan, and changes in diagnosis are reviewed and signed by the clinical supervisor. That they sign the patient's record, that the supervisor is signing all of the notes and anything in the patient record. And then verification of supervisees training, verification of supervisors training, that sort of thing. And then there's also, they want documentation that the supervisor and supervisee are meeting one-on-one, like for supervision, like about the clients that they're seeing for Optum. I mean, for all their clients. But ultimately, they're saying that like they're not just wanting a supervisor to sign notes. Like they're wanting to know that supervision is occurring. And then this last item, the supervisor's education level meets the state's clinical supervisory requirements, or the supervisor's education level is consistent with the supervisees. So I think if you're a mental health professional in the state of Minnesota, we have supervisors specific to LMFTs. I'm sure Texas is very similar. So we have supervisors who can approve or oversee or count their hours for LPCCs and LMFTs, and then licensed social workers can supervise LGSWs. So I'm implying that that's what they mean. However, I think any sort of board-approved supervisor can oversee any pre-licensed provider or sign off on their notes and provide them supervision. Just keep in mind that that pre-licensed staff likely won't be able to count those hours of supervision if you're not a board approved, not approved by their board. So in my brain, it just is much more organized to have the supervisor that is providing supervision only overseeing the people that they can sign off on their notes for, because I would be bummed if all of my supervision was not being counted when there's so much supervision to cover. But that's just a little soapbox. Okay. Any questions before we jump into preparing your practice? I'm going to take a little sip of water. So far, so good. Great. Okay, now we are going to prepare your practice. All right, so first things first, let's get organized and have a plan of attack for assembling your documents and files you do have, as well as the documents you need. Like I mentioned earlier, review the audit tools like as much as you possibly can. There's so much information in there. There's so many policies and procedures that are requested. Read through them, highlight the items that highlight it in a way that makes sense, that you know what needs to be done and what doesn't need to be done. Some of the policies and procedures are in your intake or informed consent. So you can just upload your informed consent. You don't even have to highlight that it's an item on the protocol. You can just know that, hey, those 3 or 4 items are in my intake. I'm just going to upload that, and I know that it covers those checklist items. And then start collecting documents as well. So like we went through that list before, start pulling your information that you do have. If you start You start noticing any that you're missing, you can start making that list. In addition to selecting client records, you're going to start collecting that information and deciding which client records would be appropriate. And ultimately, I think the bulk of the getting organized is figuring out what's missing. That is going to be the work around this audit, is the policies and procedures that you don't have that need to be created. That was what I spent so much time on, outside of just collecting information on the other sections. We went through this already, but I just wanted to emphasize the documents to collect: policies and procedure manual, employee manual, supervision manual, your practice informed consent, your contracts with staff and supervisors are going to be have some information as well. Like if you have a supervision contract or a contract with a supervisor, like you're going to have certain things that you want them to be doing for the price that you are paying them. That language can be used to apply to some of these policies. If you have contracts with independent contractors, some of the verbiage in there could be used for some of the points. For personnel files, I'll give you a little shortcut. I copied or I took screenshots of my personnel's like CAQH or MCC credentialing. For those of you in Texas, MCC is a Minnesota credentialing platform, but I'm sure you're familiar with CAQH. So you can just, some of the information that they ask for your personnel is it's already been completed. So I literally took screenshots of those portals for the information they were requesting and uploaded it, and put it all into one file and then uploaded it that way. It saved me a ton of time. They accepted it. They didn't second guess it. That was just a nice little shortcut. Lastly are those client records that we discussed. Reviewing the client records a little bit more, the detailed intake summary, they are looking for a very thorough data collection at the onset of therapy. They have a whole list of things about the biopsychosocial assessment and the items that they want, the data that they want collected in that. That is essentially your intake session. If you use Therapy Notes or Simple Practice, there's a template for that intake form that collects all of the information that they're asking for. So odds are, if that information was filled out in a thorough way, that it's going to be sufficient. Secondly, I know I keep banging this drum, the coordination of care, ultimately documented consent to coordination of care, and then efforts to reach that client's PCP or other healthcare provider that they wanted you to connect with, or essentially permitted you to connect with. Even if you did not connect with that PCP, but you documented that you tried, you're golden. Termination, they're also going to review. So they ask for 2 active and 1 inactive. They're asking for that inactive file so that they can also review your termination note. And termination, that includes an outcome, a recommendation, and a referral. If a client, I see your question. Sorry, go ahead, Molly.
Yep, that's what I was just gonna say. We've got a question about the coordination of care.
Excellent. So in the event that a client declines to consent talk to a PCP, you're just going to document that. Also golden. Great question. Great. Any others? You're welcome. So the what is missing probably seems or feels a little obvious. What items on the tool remain after reviewing your documented policies? You're just going to start your list of items to create. And that list is most likely going to be a very large list. And then what I would recommend is organizing those lists based on the manual or document they belong in. So if you don't have a supervision manual, you just start one and you'll start documenting all of your policies and procedures in that spot. And then you'll just add those policies as they're drafted. So if you don't have an employee manual, if you don't have a site manual, or you don't have a policy and procedure manual, like just start one and start like throwing information, even if you just find some verbiage and start copying and pasting, just put it all in one place and come back and clean it up. So here's my audit strategy. Don't do it all at once. You are not going to do it all at once. This is not a one-day project. This is a lot of work for 1 month. The 30 days that they give you to do this is a lot. So I definitely encourage you to block off a little time each day. Honestly, like 20 to 30 minutes to just plug and make a little dent each day is going to feel so much better than trying to spend 8 hours, 2 8-hour days or more. I mean, I don't know if I can calculate the amount of time I spent on this, which we'll get to the last point, which is this is not the time to be a perfectionist. But I just think you're really going to benefit from squaring off some time to work on these policies and procedures. Again, I'm reiterating, upload those documents in advance. In my head, once they were uploaded, I could just cross that item off my list and I was moving on to the next thing. So I really loved having that upload feature because it made me feel like that was done. Like once everything was uploaded, all I had to do was meet with a colleague at the end at my office, which is a very comfortable setting for me. And at that point, I was like, the hard part was over. Again, reiterating, using the audit tools as your checklist. And then this is no time to be a perfectionist. And if you try to be a perfectionist with it, you will have high levels of stress and maybe some sleepless nights, 1 or 2 panic attacks. Not guaranteed, maybe personal experience talking. I probably overreacted. I 100% overreacted, which is, I think this course is my way of working through it. But definitely, I think like approaching the audit from this standpoint and having a good attitude about it, knowing that you're going to have a positive experience is going to be a much better approach than how I handled the stress. What is your reaction so far? Hopefully I'm not discouraging you based on my experience. Awesome, great. Absolutely. Cami, I appreciate you saying that because it's so much. I showed you like not even half of the audit. Yes, you're welcome. I'm glad it was helpful and encouraging. Okay, so let's manage some of that anxiety. Let's make sure that we like have some encouraging statements, some mantras, right? So the audit is a conversation between colleagues about the documents provided. That's it. That hour that I spent, I was, like I mentioned with Miles, was very pleasant, very lovely human being. He told me that I passed my audit within the first 5 minutes of him walking in, which I was so excited. I was just done. I was like, okay, well, do we still have to have a conversation? I guess so. Okay. But I was thrilled. Like I could not have been more thrilled. Ultimately, number 2, Optum wants you to be successful and ensure that you're providing the appropriate amount of support and oversight to supervisees. Like Lee said in the chat, it is a lot, but also these are things that are needed, right? Like this is intended to create and support the appropriate level of care to clients, especially from people who are not fully licensed, that haven't finished the requirements necessary to be fully licensed. So we are held as licensed professionals to provide a certain ethical standard, and those pre-licensed staff are as well, but like ultimately haven't completed their training. So just keep in mind that Optum is like willing to allow us to bill for pre-licensed staff with some conditions, and they're pretty lofty. I was talking to Molly before that I'm surprised that more insurance companies don't have higher requirements. In Minnesota, we're pretty lucky to be able to bill for pre-licensed staff. And a lot of them just require similar to state requirements, which is pretty minimal supervision for our staff. So I'd say that Optum kind of upping that bar, all of this is ultimately going to help your clinic. There are no consequences. This one is probably what carried me through, is that there are no consequences to not passing, right? Like you're not going to lose your Optum contract. You're not going to stop being able to provide services to people with UBH or Medica or any other sort of like Optum plan. So I think that to keep that in mind, that they're like even if you missed by, maybe you got an 80 instead of an 85% on the audit, like just keep in mind that you are like that you can reapply and do it again. Yes. And then ultimately you're probably going to pass. Awesome. Okay, I see that there is a question. Are we allowed to bill for pre-licensed staff in Texas? To be honest, I am not familiar with Texas's standards. What I would look up or explore is incident 2 billing. I'll type it in the chat here. Or on your behavioral health contract. So, or you can ask colleagues if they bill for pre-licensed staff. There are states that do allow it and other states that do not, or certain insurances that don't. But that's a great question to ask when you reach out to your Optum provider. Sorry, I don't have the answer to that.
And it should also be, if you have been credentialed, some contracts have it in their language too, whether or not
Correct.
You're eligible for that incident 2 billing.
Good point. Thanks, Molly.
Yeah.
Any other questions? Yep, just the last point is you're probably going to pass. I think I went into it thinking if I was missing too much that I wouldn't. But I think if you make sure to sort of hit as many of those checkpoints as you possibly can, you're going to be fine. Okay, so that wraps up sort of the information about the policy or the supervisory protocol. I wanted to let you guys know that we have a policy and procedure template that I created as a result of my trauma from the self-induced trauma from the supervisory protocol audit that I did. So after creating a policy and procedure manual for my office, I created a template that any office could use so that other providers could have an easy way of just like not spending 4 months creating documents and policies. So there's in this policy and procedure template, there's 25 thorough policies required in the supervisory protocol audit. Each policy can be customized to your practice. It includes policies and procedures for your treatment record, supervision and supervisee policies and procedures, clinic site, and human resources policies and procedures. Here's an example of the table of contents included in the template. So you have a disaster plan, which includes your fire safety plan. We've got, I'm trying to find where is the infectious control, which is I think where your bodily fluids are. It also includes the assessment and service planning. Remember all of those items that you needed a policy and procedure for. It includes all of that, as well as a whole section on supervision and supervisees, contracting, and credentialing. In addition, similar, like they have a section for an animal policy, like if you use therapeutic animals, there's a policy included in that. A grievance process, as well as a form for grievance. There's incident reports, as well as a form for an incident report. It's exhaustive. It's over 43 pages. Some of these policies are like over 3 pages long. Here's a sample of the privacy, confidentiality, and release of information policy. And so you can see private practice, you would just do a find replace in your Word document and just put your private practice name there, as well as up here. And then here is the grievance process example. And I think I have one more, the infection control. So this is just a sample of them. So normally, so I'm just launching this. This presentation was also in congruence with getting this template out. Since you guys are the first people to see it, I'm not going to offer it at 800. We're going to do it for 25% off for anyone who participated in this event. So you don't have to decide today. We're just asking for you to decide before Sunday night by midnight, and feel free to just email Molly at info@Thrive Billing Services and just put the code in there, save with manual, and you will get it for the $600 price. And I will upload the document or send the document over to you for you to edit. In addition to, oh, sorry, go ahead.
Yeah, I was gonna say the other thing too with having this manual in place too. I didn't think I heard you mention it, but it really helps with like training and standardizing your operations as a business, like, which is really cool. It's something that for us, I know that has kind of streamlined our onboarding process and everything like that as well. And you have that standard for all of your clinical staff, your staff that's in your practice, including your support staff, can actually be able to have that same information and everybody's on board. So it's actually been extremely beneficial, even though it's 40 plus pages long. Which is what makes,
it's just nice awesome to know what to do.
Yeah, exactly.
In addition to the template, we also offer contracting and credentialing, monthly billing packages, and we also do a la carte projects. I also do consultation for private practices who are looking to bring on pre-licensed staff and reviewing contracts. I've done a fair amount of consultation for people looking to grow their practices. So that's also available, just not listed on this form, I think. And then if you are interested in any of this and you just want a free quote or want to set up a call to talk about your practice and some ways that we could be of assistance, here's a QR code to that takes you right to our website, which is thrivebillingservices.com. And we would love to connect with you. I will tell you, as a marriage and family therapist who owns her own business and owns a credentialing business, I really love talking to people about business and how to grow. And I get really excited about that process. And so if you're interested in just looking for ways to grow, I think we can be a great resource for you. So thank you very much. If any last questions, I want to make sure that we still have like 9 minutes. So if there's anything else that you guys were curious about. If not, thank you so much for joining us. We really appreciated you showing up, really appreciated your time. Thank you for allowing me to process through my self-induced trauma.
Yeah. Leah, what question do you have?
Oh, great.
If we purchase a manual, how much time would it save us?
Oh, man.
I actually asked Ashley that earlier. I said, how much time did this whole thing take you?
I would say, like, honestly, like at least 15 to 20 hours. Like if you, I should ask, how many policies and procedures do you already have? If you have 0 policies and procedures or like 4, I would say that it would save you, it could save you 20 to 40 hours. I mean, I spent a lot of time putting this together and also organizing it in a way that I probably didn't need to, but now it's to everybody's benefit. But yes, it will save you. I mean, there's a one item on the audit that is for Sentinel events, what to do in Sentinel events. And I'm going to tell you, I didn't really know what a Sentinel event was. So Cami asked, is this every policy and procedure needed? So that is a great question. So it covers, I'm going to tell you what it covers and what it does not cover, because the stuff that it does not cover would be like specific to your practice. But if you give me 1 second, I will pull up what it doesn't cover, which is mentioned on the very first page of the manual.
And Jean, yes, we will have a recording available of this, so we will make sure to get that sent out to everybody who joined, and also we'll make sure that you get a copy of it.
Here we go. Okay, so I will show you. I will actually present share the page. Just 1 second. It's coming, I promise. I'm gonna close this side.
Yeah, absolutely. The email to send that over is going to be info@Thrive Billing Services. Yep.
Okay, sorry about that. I wasn't prepared for that.
Okay, I put it in the chat so everyone can copy and paste it as needed.
Thank you very much. Okay, here is the actual. Did it show up? Perfect.
Yes.
In all 18 of my windows. There we go. So this is the only thing that's not included. So this information would be like specific to your office or in your intake information, which I did not include. So I would say it covers more than 75 to 80% of the policies and procedures that are in there. I did not do the math in advance. I apologize. But so the only things that are not included, because I did make a list knowing that that would probably be a question, the description of services and goals of care, that is not listed, the hours of service and availability, the cost of care, cancellation, no-show policy, type of care provided. All of that information is probably already in your intake. Like that information is in your informed consent. So that is not included in the policy and procedure manual. The quality improvement process and assessments of staff competency, again, those are not included. They would be like pertinent to your practice, the theory that you practice, what you want your clinicians to like what skills you want them to demonstrate. So, and those also aren't necessarily policies and procedures, but so those are the only things that are not included in it. Every other policy is in this manual. And I checked. Like 8 times.
and you passed your audit too. So
yes, that is true. That is true. I did pass. The only thing you would probably need to focus on if you got this manual would be the treatment record, the personnel files. Like this covers your supervision requirements, and I want to be clear that even though you download this manual or purchase this manual, there's still some editing to do, right? Like you're still going to need to go through and make sure that the policy matches up with your practice. But think of it as editing something versus having to find it, then edit it and reword it. And, like there's a lot of things in there, a lot of time that went into just finding some of these policies and procedures, implementing them, training them. So it's really nice to just have it and be able to edit it to suit, which is going to take astronomically less time than it took me. I apologize for the drama. I sort of apologize for the drama. There was a lot that went into it. So
there was a lot. Just on the outside looking in, I didn't have the joy, the pleasure of participating in every step. So
honestly. Awesome. Well, thank you for coming. I appreciate you all for being here. We'll make sure, I'll send this out to everybody today and make sure you get a copy of the video. That way you can fast forward through any parts that you understand and you want to review anything that you missed or want more information on. And feel free to reach out if you have any questions after the fact. But yeah, let us know. We appreciate you guys showing up and being a part of this. Have a great day.
Yes. Have an awesome weekend too.
Yes.